So I want to say welcome to all of you to our Zoom tonight. We have a great honor to have Dr. Paul Steenburg tonight as our special guest speaker, not only really talking about the habits of health as we all know it, but also from his medical practice experience. So Dr. Steenburg has a private practice in Geneva, Indiana, and has been practicing for 38 years. So amazing as far as Dr. Paul, of how many people you've seen. So we'd love to have you come on and just share with us, number one, what you're seeing in America as far as our trends in health, and then how you have been using Take Shape for Life in your practice with your clients.
Okay, thanks, Paula. Can you hear me okay?
Yes, perfect.
Yeah, it's an honor to be on here, and thanks again. So as Paula said, I'm Dr. Paul Steenburg, and I've practiced family practice medicine in Northeast Indiana for over 30 years. I told her that, 38 years sounds like a long time. It makes me feel old, but I'm still practicing, and I feel fine. I started young. Okay, so, and I've seen a lot of changes that occurred in my practice and in society as a whole over those years. So, and a lot of chronic conditions. We're being overwhelmed with a lot of chronic health conditions that we never saw before, at least not in this quantity. So, as you know, we're really in a healthcare crisis with an epidemic of type 2 diabetes, obesity, heart disease, high blood pressure, cholesterol, arthritis, and the list goes on. And type 2 diabetes used to be called adult onset diabetes when I was in medical school, and we're now seeing that occurring in children because of the rise in childhood obesity. And now we believe that a majority of our chronic diseases are caused by our unhealthy lifestyle. And as you know, we live in what's called an obesogenic society, which predisposes us to be overweight and obese. Everywhere you look, there's food, ads for food, cheap, calorie-laden, highly processed food. A patient told me today that this is Pi Day, which I never heard of. He said 3/14/16 is Pi Day. Maybe everyone else knows. I guess, so our life centers around food, our social activities, everything, centers around getting together, going and trying a new buffet. And that in addition with our hectic lifestyle, stress, and sleep deprivation is leading us down a path toward disease. And now 2/3 of our population are either overweight or obese. And this leads to a condition we call insulin resistance, which then leads into diabetes, high blood pressure, high cholesterol, and eventually leading into cardiovascular disease and shortened longevity. However, it wasn't always this way. When I started practice over 30 years ago, we saw a lot of patients with acute illness, primarily coughs, colds, pneumonia, and occasional appendicitis, that kind of thing. We had some overweight patients, but it was fairly uncommon to see someone with morbid obesity like we do today. And as you know, morbid obesity is a BMI of over 40. Over 30 is obese. We now have a new category. If your BMI is over 50, we call that supermorbid obesity. So, we had patients in those days with chronic diseases like high blood pressure and arthritis, but nothing like we're seeing today. And sadly, it's now not terribly unusual for me to see a new patient come into my practice weighing in at over 300 pounds and occasionally over 400 pounds. So I spend my days now seeing patients instead of the acute things with obesity, diabetes, high blood pressure, swollen ankles, high cholesterol, arthritis, different forms of heart disease, and unfortunately, they're often all in the same patient. I see patients every day who have all of those, and they're taking more medications to control their symptoms of these diseases, and then we have to deal with side effects of the medications. And, to be honest, people who are on a lot of pills, they just often don't feel well. When someone comes in to me and says they're tired, I look at their medication list first thing off the bat, and if they have a whole bunch of medicine, that's probably the cause. So anyhow, I eventually reached a point in my practice where I was frankly getting tired of seeing patients in this condition. Our approach of handing out diets and telling them to exercise wasn't working. Sometimes we tried to scare them into good behavior by telling them they weren't going to live long if they didn't change their lifestyle. And, that worked for a while, but it was nothing permanent. And so I was looking for a more effective way to intervene into their unhealthy lifestyles to improve or reverse their chronic conditions and even catch them upstream, so to speak, when they were still relatively healthy, to prevent them from ending up with these end-stage diseases that I was seeing every day in my practice. So around that time, Julie, who was one of my patients, still is, came into my office and she showed me a program. She wanted to lose some weight. It looked like a diet, so I looked through it. She wanted to make sure that it was safe for her to try. She'd heard about it from a friend, and she had some health conditions that needed to be addressed. She was a little overweight, had diabetes, high blood pressure, high cholesterol, was on expensive medicine, and her insurance premiums were going up. So she wanted me to look at it and give my blessing. It looked fine. I'd heard of it, but didn't know much about it. So she started that, and she came into my office 3 or 4 months later with her labs. And it was a truly wow experience. I've never seen anyone improve, get healthier so quick in my practice, in my 38 years of practice. Medication, nothing worked that well. And so I thought, this is what I've been looking for. I mean, I wanted to offer this to my patients, to my practice, but my story is that I've struggled with weight myself my whole life. And at that point, I was 60 pounds overweight. You know, you've probably heard, the story. Like a lot of us, my buttons were stretched tight. I was short of breath bending over to tie up my shoes, going upstairs. I had an overhang. I was kind of embarrassed. Patients were noticing. When we had family pictures, I'd tell people not to, I'd say, don't get my gut in the picture, please. It was really, a lot of us have been there. So I tried the program myself. I had to try it first, and it was really the simplest, easiest program I've been on. And I've been on a lot of them, and they worked, but I always gained it back. So anyhow, after a couple weeks into the program, I was starting to feel really well, and the weight was coming off, and I decided to offer this to my patients because I knew I wanted a diet for my practice, but I ended up with a lot more than that. We all know that this program is not a diet. It's an optimal health program, and we can help people by changing their mindsets, and if we can do that, they can regain their health and maintain it for the rest of their life. And I've had a lot of patients on the program, and I've guided them back to health. And now I'm getting a lot of referrals from other doctors and my patients themselves. So a lot of them have gotten off of their medicine altogether, or at least reduced it. They have more energy and they enjoy life again. They can do things they never thought they could do, getting on rides with their grandkids at the zoo and all kinds of things, getting out and traveling, getting into nicer clothes that they wanted to wear. I have one client who her goal is to get into a pink dress that she's had in her closet for years, and her husband loves it. And so that's what we're shooting for. I've seen a lot of dramatic changes in my patients on the program. As we know, like patients like Julie were able to get off of all of their medications. And patients with sleep apnea, if you don't know what that is, it's pretty common. People who are obese and overweight, when they lie down, their weight on their chest collapses their lungs, and the weight around their throat collapses their airway, and they can't breathe. And they need a machine to keep them breathing while they're sleeping, or they quit breathing and their oxygen level goes down, and it increases the risk dramatically of strokes and heart attacks. So I've had patients with sleep apnea who no longer have it, and have gone back and were retested and no longer were married to their machines. Inflammatory conditions. I have one client with severe rheumatoid arthritis, or one patient actually, and she was headed for a wheelchair and really was having a lot of trouble getting around. And on our program, which is anti-inflammatory, she's off of almost all of her heavy-duty, expensive rheumatoid arthritis medicine, and she's become very functional and enjoying life again. And she decided to pay that forward and help other people. She's been so excited about it. So anyhow, in summary there, this is an amazing program. And I really see it as a way to reverse our healthcare crisis and help people reverse their chronic conditions that they're suffering from, and, shortening their lifespan. As you know, like this generation is thought to be the first generation that will not live as long as their parents, because of all the, the health problems we're having. So anyhow, I'd like to answer any questions we have, or carry on whatever you'd like. So I think Paula was going to have some questions that she was interested in hearing the answer to.
Yes,
So,
Dr. Paul.
yeah, go ahead.
Yeah,
I hope I can answer them.
Absolutely. We have a few that have come in. The first question come in is, there seems to be a lot of controversy on soy, and that is something that it's a big deal to some people, and other people don't think much about it. Could you give us a little insight on soy, Dr. Paul?
Oh, absolutely. I know it is controversial, and a lot of people are, don't want to use products that have soy in them because of what they've heard. It may cause cancer, and especially breast cancer. A lot of women are afraid of it because of what they've heard. And then there's the GMO issue and that kind of thing. But my take on this, there's been a lot of research, is that, first of all, countries like Japan, where a lot of soy is consumed, there is a much lower incidence of breast cancer. And when people who live in Asia and Japan in particular move to the United States into a Western culture and a Western diet, their incidence within a generation of breast cancer starts to equal our rate of breast cancer. So, and the way soy works, it does have a kind of estrogen called phytoestrogen, which is a plant estrogen. It is actually around 1/1000th as strong as our natural estrogen in our body. And what it does, it sits on the estrogen receptors in our body, and it blocks our own endogenous estrogen, and so can actually probably reduce the risk of breast cancer. Cancer specialists have no problem in general with their patients being on soy. The American Cancer Society says soy in moderate amounts is fine. So also soy, it's been shown in a lot of studies to reduce other kinds of cancer, prostate in men, reduces the risk of heart disease. It cuts hot flashes. I used to tell patients before I was involved with Take Shape for Life to go and get what are called soy isoflavones over the counter, which are soy products for their hot flashes, to get rid of them naturally without taking estrogen pills. So in summary, I have no problem with soy. It's a high quality form of protein, and I tell my patients not to be afraid of it, that it has many health benefits and even can reduce the risk of certain kinds of cancer rather than be the cause of it.
Awesome. Dr. Paul, thank you so much. You have a way of explaining things just for the average layman, so I appreciate that. On the 5-in-1, another question here. We use healthy fat specifically with each day. And could you kind of explain what's the purpose? We have some people who are saying, do they really need to have additional fat into their diet?
Yeah, sure. That's a very good question. Well, first of all, and this may sound like a little contradictory, but we need fat in our diet. We need fat to survive, and I'll explain that. But our brain, for example, is almost all fat. And the thing is that there are different kinds of fat. And first of all, the reason why we want to have like low fat in our products, and that is that fat has a lot of calories. Whether it's good or bad, it has a lot of calories. It has twice as much calories per weight as carbohydrates and protein. So we need fat, but we need good fats. And saturated fat is bad, and typically saturated fats are ones that are solid at room temperature, like butter. And unsaturated fats are the healthy kind, and they're liquid at room temperature. So anyhow, the three kinds of fat that we're looking at are unsaturated, saturated, and trans fats. And trans fats are really bad. I mean, if we look at our cells in our body, I don't want to get too technical, our cell membranes are made up of fat. And again, the reason why our bodies need fat is because we are made of fat, but it's a good kind of fat. So anyhow, the cell membranes have a lot of fat in them. And if you eat trans fat, that's incorporated into your cells, and the cells of our cell walls get stiff, and they just don't work as well. If we have healthy fat like omega-3s in salmon and other kinds of fish, that's incorporated into our cell walls, and they are more flexible. Our cells are literally more flexible, and they function better. So you want to stay away from saturated fats. The good kinds are unsaturated, which include omega-3, which is in fish, omega-9, which is in olive oil, for example, and in moderate amounts so we don't get too many calories. And those good fats are incorporated into our brain and our tissues and help them function well.
Excellent. Thank you, Dr. Paul. The question came in is, there seems to be more and more autoimmune disorders being diagnosed. Every time we turn around, someone else has fibromyalgia, or they have rheumatoid arthritis, or they have Sjogren's, and just different things that are really debilitating. Can you tell us, number one, if you can explain why that's happening more? Was it never diagnosed previously? Or are we finding it earlier, or is it changed? And then secondly is, why does inflammation levels go down so rapidly when someone is on the 5-in-1 program?
Okay, yeah, another excellent question. Yes, there seems to be no question that autoimmune diseases are increasing in our society. And there are different reasons for that. First of all, inflammation in our body, which underlies a lot of chronic conditions now, ramps up our immune system. And so if our body is inflamed, that can trigger the immune system. By the way, autoimmune diseases mean that we have antibodies in our body that attack our own cells. Normally, if we have an infection, a virus, a bacteria, we produce antibodies that attack them and get rid of them. But if our immunity goes awry and it starts attacking our own cells, that's when we get an autoimmune disease. And there is one theory, you may have heard of this, it used to be in kind of a fringe medicine, but now it's in the traditional medical literature, called increased intestinal permeability, or leaky gut. It's easy to visualize leaky gut. And what I mean by that, and this is related to autoimmune diseases, are the lining of our GI tract, which absorbs all our nutrients that we need, is actually a barrier, and it keeps out the bad things that we eat, toxins and what have you, and lets the good things in, the good nutrients. Lots of things in our diet, toxins, stress, antibiotics, sometimes different medications damage the lining of our cells, of our GI tract. And it allows bad things to get in, like certain kinds of partially digested proteins. And when those proteins are absorbed into our body, they're recognized by our body and they attack them. But some of those antibodies against those foreign substances actually attack our own cells as well. So that can be prevented or treated by just healthy nutrition and a healthy lifestyle. You can heal your GI tract and thereby help, reduce the incidence of autoimmune diseases. So I hope that's not too technical, but those are, our unhealthy lifestyle and inflammation in our body are really ramping up our immune system and leading to autoimmune disorders. Oops. Hope I can't hear you, Paula. I think you may be...
There you go. Sorry, I muted myself.
Yeah.
We had a question come in that says, how is it possible that we could take on such a low amount of calories, somewhere between 900 and 1100, and yet our body not be in starvation when we're on the 5-in-1?
Yeah, that's a great question. Well, first of all, this program has been studied intensively, since 1980 and developed that way. So typically, I think 1,000 to 1,200 calories is really it's plenty. It's plenty, especially with the vitamins and the minerals in the 5-in-1 program to keep our body fueled. I don't think it goes into starvation mode. If you get down to 500 or 600 calories, then you get into starvation mode. So, 1,000 to 1,200 calories is plenty to fuel our body, keep us going, but start to utilize our fat in our body as an energy source rather than what we eat. So I think it's above the starvation level.
Okay.
It's a healthy level of caloric intake.
Okay, awesome. Thank you. And not to say that it's very nutrient dense. So
Exactly.
It's not the same as getting 1,000 calories of French fries and Happy Meals,
No, Yeah, absolutely.
Dr. Paul, why does being obese or overweight generally affect blood pressure? And there, again, as people get to be healthier, oftentimes blood pressure medication gets reduced.
Okay, great. Yeah. Yeah. First of all, whenever when we're overweight and obese, our adipose tissues, the fatty tissue in our body has a lot of blood cells. And basically, like in a nutshell, the way we visualize it is that you need to have a higher blood pressure to push blood through all those extra blood vessels. And so when we lose the weight, those blood vessels shrink or disappear, and then we need a lower blood pressure. We don't need to have the pressure to force the blood through it. And there's no question that high blood pressure leads to all kinds of conditions, particularly strokes and heart attacks. And that's why we need to treat it. But if you can get it down naturally by weight loss, that's perfect. It's better than taking medications. And I find that some of my patients seem to have like a certain cut point or a threshold below which their blood pressure comes down nicely, and above that, their pressure goes up again. And it's sort of kind of soft science. It just seems to be from patient to patient that, they'll lose a certain amount of weight and wham, their blood pressure is great. And they gain that back. If they gain it back, then it starts to go up again. But that's the main reason. We have to have a higher head of blood pressure to push the blood through all those extra blood vessels and all that extra fatty tissue.
Okay, great. Man, these are great questions coming through, you guys. So thank you for bringing those. I'm sure if you have the question, someone else is thinking it. Dr. Paul, does being healthy prevent diseases such as dementia or Alzheimer's? And if it does, why?
Okay. Yeah, absolutely. Boy, these are great questions. Thank you. Yeah, first of all, there is an idea now in medicine that a lot of our chronic diseases are caused by inflammation, including Alzheimer's disease, Parkinson's, even coronary artery disease is thought to have its basis in inflammation in our arteries. That's why you may know this, you're supposed to go to your dentist regularly to prevent heart attacks. I don't know if you know that, but the inflammation and it's not just a marketing thing from the dentist, the inflammation, like if we have inflammation in our gums and they're inflamed, that increases the inflammation in our body and increases the risk of heart attacks, believe it or not. So anyhow, one way to look at Alzheimer's disease, some specialists look at that as your brain being on fire. It's inflamed. And it's the same with Parkinson's disease and a lot of degenerative diseases in our body and our brain. So and a lot of the inflammation in our body is ramped up because of our lifestyle, stress, sleep deprivation, our unhealthy food, the saturated fats, sugar, all those things that we're not supposed to eat that are unhealthy. That ramps up inflammation in our body and increases the risk of all those chronic diseases. And so Take Shape for Life's 5-in-1 program is very anti-inflammatory. I've had patients with arthritis who report their joints feel better even before they start to lose any weight, before they take the pressure off their joints. And that's because the inflammation is going down in their body. So just reducing the inflammation in our body can definitely go a long way toward preventing chronic diseases such as Alzheimer's, which is a big thing. It's a real big thing. We're all worried about that as we get older.
Excellent. Thank you. Dr. Paul, this came in. Do you recommend that we take vitamins and mineral supplements while on the 5-in-1?
Yeah, another great question. The short answer to that is no, it's not necessary because if you're on the 5-in-1 plan, it provides all the vitamins and minerals you need. So you do not need to take an extra multiple vitamin. If you're taking one, it doesn't hurt to continue, but you don't need it. I tell my patients if they're on some other supplements like omega-3 or vitamin D or different things, absolutely no harm in continuing those. They may not need them, and certainly you don't need to take a multiple vitamin because your 5-in-1 Metafast meals and your lean and green will provide all you need.
Excellent. Thank you. Here is a personal question, but I believe you'll be able to answer it. Over the past week or so, I've been feeling weak. Assuming that I'm following the plan and taking a supplement because I'm vitamin D deficient, could this be the result of my body telling me to stop losing weight?
Yeah, another good question. Well, of course, I think it depends sort of maybe on how long we've been on the plan, because we all know sometimes for the first few days when our body is adjusting, we may feel a little tired or weak, but also our fatty tissue stores toxins, environmental toxins and things that are in our diet. And as we lose weight, those toxins are released. And that's why drinking a lot of water helps. And things like broccoli is really good at help detoxifying our body. So sometimes for a period of time after we're on the program, we do feel a little tired or weak. And it's quite often from those toxins being released into our system. But if you keep drinking your water, stay on the program, often that is just temporary. It's temporary. And then, so that's one possible scenario. Of course, it depends on the individual and how long they've been on it, and if there's something else going on, like with their health or whatever. But in general, that's one of the things that I find when people say they're kind of tired or weak. It's just that they're detoxifying, and you just give it a little more time, and then you'll feel better.
Okay. And we have sometimes people, and I know that you've mentioned this before, will even have, it might be electrolytes, Powerade Zero, something
Exactly.
like that. Okay.
Sure. Yeah, sometimes, I don't think people get real electrolyte imbalances with this because we don't have to do blood tests. Some diet plans that are sponsored by hospitals require you to have blood tests every week, and that's scary. That's scary if they're going to do that to your body. And ours isn't like that, but I think there are maybe some electrolyte shifts, and maybe initially people feel like your sodium may be a little kind of lower than what it used to be. And things like Powerade Zero, if you have a bottle of that a day, can definitely help make you feel a little better.
Okay. I think we have 2 more questions that have come in, so if anyone wants to ask one. Dr. Paul, if a pre-client has COPD, no diabetes, no warfarin, and is on oxygen, is there anything other than their doctor's approval that I need to find out about her?
I don't believe so. I mean, if that patient is overweight, which might be the main reason they'd be looking at this program, in addition to their COPD, I would expect things to improve. As you get the weight off, your lung function will improve. And I would see absolutely no problem if someone is on oxygen from COPD and they need the program. Obviously, get approval from your doctor. Things would definitely not worsen, and I would anticipate that they would improve as the patient became generally healthy. They may not be able to get off of their oxygen, but you never know. I mean, if they get healthier and lose the weight and can move around and exercise more, because moving around is great for COPD. Exercising, it improves your lung function. So I would see no problem with that.
Excellent. Thank you so much. Dr. Paul, let's see, I have one more question that came in on the program. Oh, is there a magical ingredient in the food that causes people to lose weight? And if so, would it be considered dangerous? Why are people losing weight rapidly, sometimes even as much as 12 pounds their first week?
Yeah. Well, first of all, no, there is nothing magical in the food. I've had patients ask me that too. And one said, what is it in this food that you're not hungry? I mean, it's wonderful. What do they put in it? And the answer is nothing. It is just regular food. It is real food, just in a different form, than what we're used to, perhaps. So anyhow, the reason we lose weight quickly is a couple of reasons. First of all, in some people, it's really quite a drastic change to their unhealthy lifestyle and what they're eating, that the weight's just naturally going to come off. Others, we always lose a little water with any program. When we first start, we always lose a little water. That's why we lose, 2 to 5 pounds per week in the first couple of weeks, and then it slows down a little bit typically. But so some of that is water, and it's just the reduction in calories, of course, but also healthier nutrition. So there's nothing in it that's dangerous. There's no drugs involved, and it's just, I know that some people feel that losing weight rapidly is unhealthy, but in my practice, I've had patients lose, some of them very quickly, and they feel great. I mean, I don't think there's anything unhealthy about it myself. So there's nothing in it, no magic ingredient, nothing added, certainly nothing that will hurt you.
Okay, great. Thank you. A couple more. We'll finish these up. Number one, I get very cold. Is this because of the program?
Now, that's a good question. And actually, I'm not sure if I have a good answer to that because some clients, I mean, I've heard that before. I jokingly tell them it's because they're losing their insulation, when they're losing their fat. And that may have something to do with it, but I'm not really sure. So maybe, we could do a little research on that and find out, but not everyone. I don't know if you've had any experience with that, Paula, or with nutrition support or anything that you can answer that, but I don't have a good answer for that one other than they're losing their insulation and
Yeah.
cold more.
And I will say to the person who asked this, yes, it is very common. We find that
Yes.
many women want to wear a jacket or a sweater. For some reason, when you're in fat burn, you are a little chilled. But Dr. Paul will know the medical reason. We just know the truth, what the truth is. Okay, two quick ones. Dr. Paul, there's controversial reports on the value of taking a daily aspirin. What do you recommend?
Oh yeah, no, that is controversial, and there's certain people who need a daily aspirin. Like if certain people with vascular disease, if you've had a heart attack or a stroke, some people you want to prevent another one, and that can be very instrumental in preventing future vascular events. If you're a diabetic, it's a good idea to take an aspirin because you're at a higher risk. And I don't mean to be giving medical advice. You have to check with your own doctor, but this is my advice in my practice. And if you're under 40 and young and healthy, there's probably no need to take an aspirin. But as you get over 40, and especially if you're getting some of the health-related conditions that will increase your risk of a heart attack or stroke, an aspirin can be beneficial. And I usually recommend just a baby aspirin or one or two, no more than that. Some people with medical conditions need to take a full aspirin. There's a little risk of bleeding in some people, but baby aspirin is pretty safe. I mean, they're called a baby aspirin or adult low dose, so they're pretty safe. So in some cases, it's beneficial, but I wouldn't say for everyone. I don't think it's a good idea for everyone across the board just to start taking an aspirin for disease prevention.
Okay. Well, Dr. Paul, thank you so much. This has been extremely interesting, and I hope that all of the people on the line have enjoyed it. Let us know, please, if you'd like to see this happen again, every once in a while, as long as, Dr. Paul, as long as you're open to do so. I think people have these questions in their mind, and they wish they had someone to ask.
Well, thank you. Yeah, it's a pleasure being on. And my goal is to help people in any way I can. That's what we do. And so if what I've said helps people, I'm very glad, very happy.
We love it. So Dr. Paul, thank you so much for joining us and giving us your expertise without paying for it. So we appreciate that. No doctors call copay here.
Yes. Thank you, Paul. It was a pleasure.
Thank you. Have a great evening, everyone. We look forward to seeing you all next week.